Hello, everyone. I'm Chuck Mancino, Director of PR for Pulsed Energy Technologies. Here with us today is Josh Silver and Dr. Eric Blum. Josh Silver is President and CEO of Pulsed Energy Technologies. He has been involved with the development and application of PEMF technology for over 13 years. He has consulted with and lectured to multiple professional sports teams, thoroughbred horse trainers, doctors, scientists, chiropractors, and other practitioners. On the clinical implementation of the technology, he is considered one of the world's foremost authorities on PEMF therapy. Dr. Eric Blum earned his Doctor of Chiropractic at the Los Angeles College of Chiropractic, graduating in 1999. Dr. Blum started his journey as a chiropractor in 2001 in Thousand Oaks. He opened his own practice in 2004 and geared his knowledge and techniques to target athletes and sports-related injuries. Being that the human body's recovery process varies from person to person, Dr. Blum has utilized and perfected multiple treatment techniques to target each type of injury for optimal recovery and proactive treatment. Today we are talking about PEMF technology and its benefits to healing the body. With that, take it away, Josh.
Thanks, Chuck, for the introduction. So for all of you viewers out there who are not familiar with high-powered PEMF therapy, PEMF stands for Pulsed Electromagnetic Field. And in brief, what the technology does is every cell is like a little rechargeable battery. And when you have injury or illness or disease, the actual voltage in that cell is reduced. The high power current from the electromagnetic pulsar that we make passes a very strong field through the cell very fast, and each time the cell retains the charge, with the byproduct being that we're able to accelerate the natural healing process of the body, and the user sort of actuates this as they feel the pulse go right to the spot where the injury is, and if they don't have injury, pain, or disease, or a problem, they just feel sort of their muscles jumping, or what we call electromagnetic induction. So I want to take a minute here and just go over in brief the 6 things that we're going to get a chance to talk to Dr. Eric about. The first thing is we're going to hear a little bit, in his own words, some of the results he's seen with the high-powered PEMF from Pulsed Energy with some of the pro athletes and the sort of elite performers that he's gotten a chance to work on over the years. We're going to talk about a little bit about the 20% or so conditions that maybe chiropractic isn't 100% effective on, and hear his thoughts on where PEMF fits into that. We're going to ask him directly, what did the machine resolve for his clients that he didn't expect it was going to do anything for or work on? We'll hear about maybe the top 2 or 3 toughest cases that he saw results on. And then the opposite side of that coin, we want to hear any cases, any conditions, anything that it did not help. We think high-power PEMF is fantastic, pulsed energy is amazing, but on the other side of that coin, like I mentioned, there are things that it won't help. And we want to hear if he's run into that. And then lastly, we want to hear sort of his unique marketing proposition, what he does to advertise or promote or sort of get the word out at his clinic. So I just want to take a minute and say thanks for joining us, Dr. Eric. It's always a pleasure to be with you. And I guess I want to jump right into it and ask you, tell us a little bit about your experience with some of the pro athletes and what you've seen with the PER 2000 and Pulsed Energy.
Thanks. So we've seen a number of different things. We have a lot of athletes. Being a professional athlete is very, very hard on your body. So you need to take a lot of different avenues to treat, prevent, and so forth throughout the year. Not everyone gets the same treatment. So a lot of times when some of the athletes come in here and they see the machine, they're like, where's this been all my life? And so it's really cool introducing it to them and showing them, hey, we could show improvement, see how it heals, depending on what the issue is and so forth. So a lot of guys will come in for a specific injury in the off season so we could get them ready for the season. And that's where we treat all these nagging injuries. A lot of guys have really enjoyed it and see the benefit of the technology to the point where they buy their own machine, take it with them throughout the season. Because depending on the sport, baseball, for example, If you're on the road, you're sitting in the hotel room doing nothing. So it's like if you're going to be in the room on your phone, you might as well do something productive for your body at the same time. So a lot of these guys take a proactive approach, and it's a way to get the overuse, the inflammation down, and they'll sit with the machine for hours. If they're a pitcher, it could be on the shoulder, the elbow. A catcher could have it on the knees. Guys could have it on the back. You could put it wherever, So it's really cool when they get the big picture and then they're like, I need my own machine.
Well, and that sort of lends to a good point. You just in terms of where your experience is, you were the Dodgers team chiropractor for a number of years. You've been what I like to call a hired gun by some of the high-end elite athletes. Typically, in your experience, they haven't experienced this in the same way general chiropractic patients have. They haven't been exposed to it. Is that a fair statement?
It is and it isn't, actually. So if a guy goes to his regular chiropractor, who really just goes in, adjusts, maybe does a little muscle work and some electric stim, they have no idea what the technology is. No, they have not experienced it. More and more training rooms are getting the technology. So guys, depending on what team they're with, obviously, if a team has it, then they may have been exposed to it. And then again, it depends, is the training staff utilizing the technology also? Because we've seen it sit in the back corner of a training room just because the head trainer isn't familiar with it, and then the guys are missing out. And when they get their hands on it and feel it, it's like, this is totally different. And that's one of the things that separates us and makes us a little different. We're not doing anything crazy. It's just utilizing an amazing machine, but we have access to it, and now they have access.
It's, as you're saying that, what word is coming to my head is cutting edge, and it sounds like, I know from personal experience you are on the cutting edge, but it sounds like more and more these guys are finally getting exposed to the cutting edge stuff as opposed to just, tape it up and get back in the game type of deal. And that's really what where I see this technology going is it ceases to be with the organization and now starting to go in the individual through people like yourself and others that are out there that, like I said, that are hired guns.
Correct.
So with that, on the opposite side of that coin, we have the high-end athletes. If you guys ever get a chance to come and tour his facility, he has awesome memorabilia from a lot of the different athletes and pro ball players that he serviced. But also, there's a lot of what I call grannies that come in here. There are people like you and me, everyday chiropractic patients that have long-term chronic pain that are seeing results. And that is sort of the theme that I've heard a little bit with our machine in chiropractic is that standard chiropractic care can easily resolve 80% of the issues. And there's 20% that maybe needs a little helping hand, and that this machine is effective up to 80% of those 20%. What do you sort of think about that statement? Is that a fair statement?
Yeah, it is fair. This is another tool in my pocket. It's not for everyone. Some people just don't like it for whatever personal reason, or it could be a contraindication. Look, we have patients with pacemakers. I'm not putting the machine on them, obviously. But with that said, chiropractic is amazing at helping assist the body to heal itself. We can only do so much also. If there's a structural issue and a chronic damaged thing, such as a disc, because there's stenosis or a bone spur that's rubbing up on it on a regular basis, I can adjust it all I want, it's still going to be there. So the idea is if we could get the machine to help settle down the inflammation, then the adjustments will last longer, the patient's out of pain because it's not irritated, or if it's a labrum tear or a meniscus, whatever the issue is, I'm working more superficial stuff with the muscle work. The adjustments is deeper than superficial, obviously, but then there's a whole nother level I can't get to with my hands. And electric stim's an electric Band-Aid. You're not fixing anything with the stim. It has its purpose and time, obviously, to utilize it. But with the pulse machine, we're able to get down to the root cause. And that, instead of seeing a patient, you hear stories, people going to a chiropractor, oh, they wanted to see me 3 times a week for 6 months. Well, we don't need to do that. We could see you a lot less, save you money. So then you say, well, you're missing out on money. I don't care about the money. We're helping the patient, but we don't advertise because everyone refers people to us because we're getting them better faster, and it's staying and lasting, so we get the better results. And then everyone's like, oh my God, they got this machine and they do this or whatever it is. So
it's so for anybody who has watched the last couple webinars, you'll notice a theme, and Dr. Eric really hit on 2 big points. Is first, we're hearing a lot that a benefit that you're seeing from this machine that is working sort of in harmony with what you do is interrupting that inflammation cycle, that it's able to get rid of some of that inflammation in which to enhance the adjustment or the work that you're going to do. Because on the other side of that coin, there's the yin and the yang. You need the manual adjustment, and then you need something deeper penetrating in the body.
Yep.
So it sounds like, look, if you can hear from his words and from some of the other doctors' words, it's a yin and a yang relationship of the adjustment and the treatment in order to break this cycle, in order to get rid of the pain and really make the adjustment last even longer. And that's sort of what we're hearing from all of these top level docs who use the technology. So I tend to think I'm going to take your guys' word over it than somebody else's. And that's where it seems like this is going. Like we're starting to hone down or narrow down where PEMF goes. So with that, what are some of the cases that this machine may have resolved or really sort of done a fantastic job on your patients over the years that you didn't think it was going to do anything or didn't think it was going to help?
So the craziest story, we had a high school cheerleader. So granted, she's younger, she's always going to heal faster, but twisted her knee, ripped both horns of her meniscus, lateral and medial, and a complete tear of her ACL. No question about it, needed surgery, obviously. However, the ortho wanted to wait about 5 weeks before she had surgery. So she came in 3 times a week for the 5 weeks leading up to it. All we really did was a class 4 hot laser, the pulse machine, and then game ready, for the ice after and stuff. When the surgeon went in, one horn of the meniscus completely healed. The ACL reattached to the bone. Now, he had to cut it and put it into the right place. He's like, Eric, what the hell did you do? It's like, this is what the technology allows us to do. I could never do that adjusting someone at all, So that
I love that story.
Yeah,
I've heard that one, and I was hoping you were going to share. Yeah. I love that one.
That one's amazing. We had a pro golfer. He was goofing around at a concert, fell, broke his wrist. 5.5 weeks later, he was back on the course playing with a fully healed fracture. I let him take the machine home. He'd sit with it almost 24/7 because he's crazy. And he listened and he did it. And the results showed, A random one, we had a patient coming in for an older lady for low back pain and stuff, and treated her short time, a week, 2 weeks, whatever. And then she said to me, I never told you this, but my urinary incontinence is gone. I'm like, what? She's like, yeah, I never told you I had a problem. And really, obviously, we're adjusting her and doing other stuff, but the machine, that's one of the things. And I would have never thought to go there.
Sure.
Granted, she never said anything to me about it, but the fact that she noticed that was crazy.
That's pretty awesome just on her own. And it also shows about the systemic nature of the device, that it really is about total body healing and the body sort of, the immune system being empowered by the body, and then the machine and other stuff to accelerate the healing process. So it falls in line again with what we've heard from a lot of these elite and top level doctors like yourself that are treating the high end clientele and the everyday clientele, and you're seeing across the board results, where I think as a practitioner, you want some predictability with what you're doing, and this gives the predictability. So now on the opposite end of that, and we've had this conversation over the years, look, high power PEMF is awesome. I've been doing this more than half my life, but it's not the panacea. It's not the be all end all. It's not the magic fix button and it fixes everything. So with that, what are maybe some of the conditions that you've run into that it didn't help, that it didn't do anything for?
So I got a new one for you.
Oh, nice.
I've not told you this one. So we take care of the one of the local high school football teams throughout the season. One of the kids broke his hand. So they went and got a casket and stuff, and we started treating it just with the pulse machine. We had to stop treating it. And the reason we had to stop is it was working too well to the point where it was going to cause damage. And so the way the ortho explained it was we were getting rid of the inflammation too fast, that the bone was shifting down, and we wanted the inflammation to stay there and maintain the bone where it was. So we had to pull back for a few weeks, let the scar tissue and the inflammation stay to maintain the bone because it was a small bone. And then we could start back up after it was stable and we knew we weren't going to get rid of too much inflammation for the bone to sink.
So that's like one cog in the wheel working faster than all of the others as opposed to working in sync. That's really interesting.
Yeah.
So there was no question that you were accelerating bone growth and getting rid of inflammation. It was just too fast.
It was too fast.
That's interesting. Do you think the person's age had anything to do with it because they were young and they were going to, you know what I mean? They were still growing.
I mean,
that's a really interesting one.
I wouldn't say that they were still growing was an issue. They had open growth plates, obviously, and stuff like that. So you really had to be, that is totally different than treating a pro golfer who isn't growing, obviously.
Sure.
And it's a different kind of break in bone also. So
that's crazy.
Yeah.
I mean, that is a really unique one. Is there so is there anything else like over all these years? How long have you had the machine? You've been doing this 7 years?
No, it's longer than that.
It's got to be, right?
It's got to be at least 10 years.
Yeah, that's right. Okay. Yeah, I forgot what year we're in.
Yeah.
So in all those 10 years, what didn't it work on? Is there anything that jumps out?
It's not that it didn't work necessarily. And I'd say some people just reacted different. Some people are very hypersensitive to any kind of electrical fields. I have a good friend who's like, look, anytime I get near something, I'm going to pass out. He's like, but I want the machine. So we'd lay him down, we'd put the machine on him, he would pass out. But we had some other patients that we did not know were going to get that response, and you could see them go white and just lose it, basically. So you always have to be aware of that. Look, I'll be honest, I had a couple patients with AFib, and the machine switched it up on them, and they had to go and reset it in a sense. So we've changed the way we'll treat someone with any kind of heart issue. And someone with AFib now, we just, if we're doing it in an extremity or something, fine, I got no problem, but I just don't want to mess with that and have that as a potential side effect.
So that's always good for some of the young and up-and-coming practitioners that are really new to PEMF that we try to coach them on, is you can say no. You can say no to people and say, hey, we don't think you're a right candidate for this. We don't think it's going to be effective, or we think there could be a potential issue, so we don't want to do it.
Look, even though the machine, we know the technology could help pretty much everyone, it's patient safety. And even though I want to do it, I may not be able to do it. And if it takes a little longer to get the results I want, I'd rather play it safe than be too much of a cowboy and just go in and see what happens.
We heard another story about a doctor who had a patient that came in that lied on the form about having a pacemaker. And it just happened to be that his wife was in the room and heard the conversation. And she basically said, honey, you can't use this. You have to tell him you have a pacemaker, because he wanted to use the machine so bad. He was willing to risk life and limb. It just sounds like it's not worth
it's not worth
doing that. So we're gonna throw back to Chuck here in a minute, because Chuck has some questions from some people that have emailed questions in. I'm going to bring them up and ask them here, but a couple of you have had them you want to ask specific questions about conditions. Have you had any experience with like fibromyalgia or chronic fatigue or Epstein-Barr, Guillain-Barré, any sort of low energy type of issues where it's more systemic of a problem than, let's say, my knee hurts or my back hurts?
Yes and no. We have had some people come in, but I think it's a combination of so many different things. I mean, we're recommending supplements at that point, and the walk-in cryo chamber is good for a lot of that stuff. We'll use the machine on more for the organs in the body, hitting the chest, the back, liver area, crown of the head, and whatnot. Energy, I don't know, energy wise. But, if you get them out of pain, then they're not complaining as much. So they're not as sad. Depression starts to go away, so they feel better. So something like that, I wouldn't say it's just one machine doing it. It's a combination of a lot of stuff.
It goes back to what you said at the beginning about another tool in your pocket. And I mean, we have said this on this a couple times. It's making the right soup, and it's mixing the right ingredients and stuff like that. So it sounds like it's a part of that. So the other question that we have is from Joseph, who wants to know, what do you think about using PEMF as a performance enhancer? Like, I'm guessing for athletic performance, things like that.
I mean, I guess technically it is. I mean, it's a legal way to accelerate the healing process, get rid of the inflammation, so the person's going to perform better. Something we have not discussed, actually, and I'm curious to get your point on this. We treat a lot of horse riders. My understanding at some of these big competitions, they have now outlawed the pulse, the laser, some of the cryo units, shockwave, and all that stuff, because they're saying it is an enhancement. So
they've done that 48 hours before the event. You can't use the machine because of that particular reason.
So I mean, is it going to come back to, I work with a lot of the Olympic swimmers, at one point, and you're not drug testing for it, but if someone is doing something and not everyone else has, the ability to utilize it, I don't know, is it a form of enhancement? Sure, technically.
So, I mean, I can tell you from personal experience, it makes me look like maybe not like I'm in my mid 40s when I perform athletically, because I can notice a difference and I can feel a difference, but I'm different than the elite athlete. So to hear that from you and to hear that you're aware of what's happened in the equine industry, the answer is yes, it is. And there's almost a way that you have to go about doing it before you get in trouble. So my last question that I have to ask, what would you say to any practitioners that are looking into this technology for the first time, that have either not experienced it before, said, I read about it in a magazine, I saw it at a trade show, I'm thinking about bringing it to my office, but they don't know what to expect because it's a doohickey, it's a thing. What would you sort of say to them to help explain this is what you can expect generally in an office?
As a chiropractor, for the most part, we get introduced to really three modalities that a lot of people utilize. electric stim, ultrasound, and lasers. Obviously, you got cold laser and hot laser and stuff. This is a new one. I would say you just got to do it. If I had one machine and one machine only that I could utilize, it's going to be the pulse machine. Get over the fear. The word's going to get out. People are going to hear. And if you explain it the right way and show them, and then they feel it, it's a no-brainer. I mean, it really isn't. And I was just in South Korea with one of my Olympic swimmers for World Championships, and he's like, bring the pulse machine. You know, so once people know and see, they're going to want it, and it'll change your practice. I mean, there are all different ways to utilize it and market it and whatnot. But yeah, I think
It's just a matter of getting results. That's what it sounds like.
you'll get the results. Now, if you're a money guy who, you know, you want to see people, 6 months, 12 months, probably not good for you because you're going to get them better too fast. But like I said earlier, we get so many new patients that it's crazy because of how we treat, what we do, and our honesty with the patients.
That's awesome. And, I've said this on a couple of the other recordings, is we like to have people like us, like that fit into that mode. And I've known this for years, but you're the same way, because it's about getting the patient better in the fastest, most effective way possible. And all the rest comes after that. And it's a good message to send, not only to the people that are using the machine out there, but the practitioners that are either just getting a machine or thinking about it, because if you prioritize the healing of your patients first, sort of the rest follows.
Yeah.
So we took about 30 minutes today to talk to you guys with Dr. Eric about his experience with pulsed energy. And I didn't even realize till we started that it's been 10 years. I thought it was less. I should have gone by how many kids I had and how old they were. We talked a little bit about his experience with the pro athletes, some of the things in chiropractic care that can use the help of pulsed energy. We talked about a couple of the issues that he wasn't aware of that the machine was going to help with, that it did. We talked about some of the tough cases that he got clinical results with. We talked about some of the things that it didn't work on or worked too well on, that those people wouldn't be additional candidates for treatment. And the last thing that we really talked about was sort of his overall experience. And I don't want to say marketing or advertising, because what we've learned is sort of his goal here is to get the patient better, fast, effective, as safe as possible. And the word of mouth spreads.
Yep.
So we're going to throw it back to Chuck just for a little tie-up here. But thank you all so much for watching. And most importantly, thanks to Dr. Eric for being here. It was awesome. Thanks. And tune in next time, and we'll have another sort of special event for you guys.
I want to thank Dr. Blum and Josh Silver for their time today. We really appreciate it. PEMF technology is beyond exciting, and look forward to the further advancements we have in this area. Anyone wanting more information can go to pulsedenergytech.com. That's pulsed with a D on the end. Thank you for listening in, and be well.